Hello everyone, we are from SGD B9. We would like to present our student projects about effectiveness of mind-body therapy in improving sleep quality in individuals with sleep disorder. Before we start, I would like to introduce our members that's shown in the slide. And now, for the speakers, the time is yours.
Hello, my name is Medina Fardim with the last three digits of my student ID 003. Sleep is a crucial part of human health, yet millions across the globe contend with sleep disorders that significantly undermine their quality of life. The urgency to address sleep disorders has never been greater, particularly in a world where stress, digital distractions, unwanted side effects, and dependency risk from pharmacological interventions, as well as an increasingly sedentary lifestyle. Those all contribute to the growing prevalence of sleep disorders. Amidst the rising demand for effective non-pharmacological interventions, mind-body therapies have brought promising solutions for improving sleep quality. Next slide. Mind-body therapies include various practices that utilize the relationship between mental processes and physical health to enhance overall well-being. These therapies include meditation, tai chi, qigong, yoga, relaxation, and music therapy. Although there is encouraging evidence supporting the effectiveness of mind body therapies, a notable gap persists in their incorporation into conventional management strategies for sleep disorders. This discrepancy is attributed mainly to insufficient awareness, the absence of standardized protocols, and a lack of comprehensive guidelines for healthcare practitioners. As healthcare costs continue escalating and patients increasingly seek sustainable non pharmacological alternatives, conducting investigations into the effectiveness of mind body interventions becomes essential. This literature review offers significant insights into the role of mind body therapies in enhancing sleep quality for individuals experiencing sleep disorders. Next slide. Considering the background provided in this literature review, the problem can be formulated as follows. First, what specific techniques within mind body therapies have been shown to be the most effective for different types of sleep disorders? Second, how can healthcare practitioners integrate mind body therapies into conventional sleep disorders treatment plans? Third, what further research is needed to establish standardized protocols for implementing mind body therapies in clinical settings? Next slide. Based on the problem formulation, the objectives of this literature review are as follows. First, to understand specific techniques within mind body therapies that have been shown to be the most effective for different types of sleep disorders. Second, to make healthcare practitioners know how to integrate mind body therapies into conventional sleep disorder treatment plans. And third, to understand further research is needed to establish standardized protocols for implementing mind body therapies in clinical settings. Next slide. This literature review can give more information and insight into the topic of the role of mind body therapies in enhancing sleep quality for individuals experiencing sleep disorders and can be used to further widen the knowledge regarding this topic. That is all from me. Next slide.
Hello, my name is Kade Bintang Arsia Putri with my last three digits of my student number is 056, and I'll explain about the definitions of sleep disorder. Sleep is a physiological and behavioral state marked by changes in brain electrical activities which result in altered awareness, diminished sensory responsiveness, and a decrease in a muscle tone. Sleep disorder can present as complaints or insufficient sleep, excessive sleep, or unusual movement during sleep. These disorders are common and can significantly impact a person's health and quality of life. Poor quality sleep has been linked to a range of issues across various body systems, and including endocrine, metabolic, cognitive, and neurological disorder. Sleep disturbances are prevalent among adults, and children with these issues may exhibit different symptoms compared to adults, such as exhibit motor overactivity, inattentiveness, irritability, or oppositional behavior rather than overt sleepiness. The clinical manifestations of sleep disorder vary related on the specific condition. Generally, sleep disturbance can present in a various way, often including insomnia, hypersomnia, circadian rhythm sleep-wake disorder, parasomnia, and sleep-related movement disorder. That's all from me, and the next line will be presented by my friend. Thank you.
Hello there, my name is Patricia Linjatan and the last three digits of my student number is 171. So I want to explain about the common types of sleep disorders. There are different causes for different sleep disorders and here are some of them. The first one is insomnia. It's categorized by difficulty falling or staying asleep. Insomnia is often caused by stress, anxiety, lifestyle, or environmental factors. Chronic insomnia may lead into long-term health effects impacting mental and physical well-being. The second one is sleep disordered breathing or SDB. Includes conditions like obstructive sleep apnea, where airways blockage disrupt breathing during sleep, and the SDB often correlates with obesity and can cause daytime fatigue, cardiovascular issue, and cognitive impairments. The third one is hypersomnolence disorders. This group includes narcolepsy and idiopathic hypersomnia, where individuals experience excessive daytime sleepiness, often due to irregularities in the brain's sleep-wake regulation. This disorder can significantly impair daily functioning. The fourth one is circadian rhythm sleep-wake disorder. Disruptions in the body internal clock cause issues with sleep timing, as seen in shift work disorder and delayed sleep phase syndrome. This also often results from lifestyle patterns or a mismatch between internal circadian system and the external environment. Another one is parasomnias. It involves abnormal behavior during sleeping, such as sleepwalking, sleep terrors, and also REM sleep behavior disorder. Genetic and environmental factors also contribute to these disruptions, which may affect both on the individuals and the others. The last one is the sleep-related movement disorder. Disorder like restless leg syndrome can cause involuntary movement during sleep, leading to poor sleep quality. It also often linked to genetic factors or deficiencies like iron. Each disorders affect quality of life and may require tailored treatments, including behavioral therapies, lifestyle changes, or medication, depending on the type and severity. That's all for me. Thank you.
Hey everyone, my name is Farel Armanul Manik with the last digit of student number 243 and I'm going to explain about meditation. Meditation has been shown to be an effective therapy for improving sleep quality in individuals with sleep disorder. MBSR involves structured practice like sitting meditation, walking meditation, and yoga conducted regularly over an 8-week period, which has been effective in reducing sleep disturbances and enhancing overall quality of life. The effectiveness of mindfulness meditation also depends on the frequency and duration of the practice. Mindfulness meditation also offers a safer alternative to pharmacological treatments, which often carry side effects. Mindfulness meditation is increasingly valued as a non-pharmacological intervention for improving sleep quality.
Hello, my name is Nyoman Gede Wilaguna dari Paramarta, and my last three-digit number is 180, and I'm going to explain about yoga. Yoga is increasingly recognized as a holistic practice that effectively enhances sleep quality, particularly for individuals experiencing sleep disorders. By integrating physical postures, breathing techniques, and mindfulness, Yoga addresses root causes of sleep disturbances such as stress and anxiety. Yoga improves mental awareness and focus, helping individuals with sleep disorders manage racing thoughts and worries. Meditation and mindfulness practices in yoga encourage staying present, reducing mental distractions and anxiety. With regular practice, individuals learn to observe thoughts without judgment, promoting calmness and a sense of peace before sleep. The positive impact of yoga on sleep has been well documented in the scientific literature. Research shows that yoga interventions can lead to significant improvement in various aspects of sleep, such as reduced sleep onset latency, increased total sleep duration, improved sleep efficiency, and better overall sleep quality. So that's all for me. Thank you.
My name is Igusya Ibrahimita Haskirana, and the last digits of my student ID are 212. I will be continuing the explanation about Tai Chi. So, Tai Chi is a Chinese mind body exercise that has been used for health promotion and disease prevention in Asia for hundreds of years. Multiple studies have proven that Tai Chi was effective in improving health of those with cognitive function problems, pain, arthritis, mental health, and even controlling glucose level in those with type 2 diabetes. A study that was conducted to assess the benefit of Tai Chi in people with sleep disturbance was using data analyzed between September 2018 and August 2020. Compared to the control group, there was a significant reduction of wake time after sleep in both exercise and Tai Chi groups. There was also a significant reduction of awakenings between sleeps in Tai Chi group compared to the exercise group, but not enough to state its effectiveness compared to the conventional exercise. That's all for me. The presentation will be continued by my friend.
Thank you for the opportunity. My name is Joanna Alisa Tanuraharja with the last three digits of my student number 079. This time I'm going to explain about relaxation therapy. So there are relaxation techniques which include a wide variety of practices intended to reduce psychological arousal, calm the mind, and promote a state of relaxation, supporting the initiation and maintenance of sleep. So the first one is progressive muscle relaxation. This technique is done by tensing 16 groups of muscles in the body one by one and relaxing them again consciously. It works mainly by distracting attention and sensations, as well as inhibiting electrical activity in some parts of the brain. Autogenic training is a therapeutic method that utilizes homeostatic brain systems to enhance existing natural self healing processes. The third one is the imagery technique. The imagery technique functions as a form of perception where one would visualize pleasant imagery. Because of its simplicity, it is reported most likely to be utilized at home. The last one is the biofeedback. The biofeedback technique uses electrodes directly on a person's body that can measure their pulse, brain activity, as well as muscle tension. However, some recent studies found it is not proven to improve sleep efficiency and total sleep time. Overall, relaxation techniques are highly recommended to manage sleep disorders and to be combined with conventional multidisciplinary medical care. That's all from me. The next will be continued by my friend. Thank you.
Let me introduce myself. My name is Rian Andrea Pranto with last digit number is 0 I will explain to you about the mechanism of music therapy in sleep improvement. It's including reduction of anxiety and depression, enhancement of relaxation, improvement of sleep quality metrics, and integration with mind-body therapies. So music plays a significant role in enhancing the effectiveness of mind-body therapies for improving sleep quality in individuals with sleep disorder. Music therapy has been shown to effectively reduce anxiety and depression, which are common comorbidities in individuals suffering from sleep disorder. The soothing effect of music can promote relaxation, which is crucial for initiating and maintaining sleep. Music therapy can lower heart rates and reduce cortisol level, leading to a more relaxed and state conducive to sleep. Research indicates that music therapy can lead to statistically significant improvement in sleep quality metrics such as the Pittsburgh Sleep Quality Index or PSQI. In clinical setting, patients who participate in music therapy report better overall sleep quality and reduced insomnia severity compared to those who did not receive such intervention. Mind-body therapies like yoga, tai chi, and meditation often incorporate music as an integral component. This practice not only focuses on physical movement but also emphasizes mental relaxation and mindfulness. The combination of rhythmic movement, breathing exercise, and calming music creates an optimal environment for improving sleep quality. Alright, that's all for me. Thank you.
Greetings, my name is Tracy Odela Geraldia Kemal with my student ID number 115, and I'll be talking about factors affecting mind body therapies. First are physical medical conditions. Underlying health problems in a patient will result in lower effectiveness of MBT compared to healthier patients. For example, chronic pain or IBD. Next is duration of therapy. Some studies suggest that the longer MBT is practiced consistently, the better the results, but this is still minimally evident. Next is type of MBT. Types of MBT has different effects for different types of people. Meditation improves sleep quality in insomnia and cancer patients, and Tai Chi reduces insomnia, especially in elderly and chronic patients. Meditation has the biggest effect on sleep quality compared to other MBTs. The last one is individual beliefs, in which the outcome of MBT may be less effective if the patient does not believe that their symptoms may be caused by a psychological or mental factor, thus believing that MBT won't work for them. Another reason is if they find it difficult to follow the consistent routines required for MBT. That is all from me. Thank you.
Hello, my name is Ananda Aulia with three last digits of my student ID number is 015. Now I'll present you about the mechanism of mind-body therapy in improving sleep quality. Mind-body therapy or MBT is a holistic approach that involves practice such as meditation, yoga, tai chi, and mindfulness to promote harmony between the mind and body. Mind-body therapy improves sleep quality through three key mechanisms. First, it reduces stress and anxiety by activating the parasympathetic nervous system, which lowers cortisol levels and promotes relaxation, helping the body to prepare for sleep. And the second one, MBT enhances emotional regulation and cognitive process through mindfulness, enabling individuals to manage negative thoughts and prevent excessive rumination, which often disrupts sleep. Third, the physical relaxation induced by practice like yoga and tai chi reduce muscle tension and increase physical comfort, improving posture and minimizing discomfort during sleep. Together, these mechanisms lead to deeper, more restorative sleep, reduced insomnia, and a consistent healthy sleep pattern. That's all from me. Thank you.
Hello everyone, my name is Putusan Gitani Rajanari and the last three digits of my student number are 049. I'm here about to explain the effectiveness of MBT or mind-body therapy for improving sleep quality. So, through enhanced anti-inflammatory signaling, mind-body therapy or MBT may affect brain areas that control downstream stress response pathway, such as the autonomic nervous system and the HPA axis, potentially stabilizing the circadian rhythm and safeguarding sleep health. One of the examples of MBT is yoga. In a study conducted by Adnyani et al. 2023 has proved that elderly who do yoga more than twice a week has a good sleep quality of around 25 people or around 73.5%. On the other hand, those who practice yoga for only less than 2 times a week, only 5 people have a good sleep quality or around 31.3%. By doing exercise as much as more than 2 times a week will improve the quality of a person's sleep, especially the elderly, by 2.5 times better. Thus, it can be said that the MBT or mind body therapy is fairly effective to be used as the therapy to improve quality of sleep. That's all from me. The next slide will be presented by my friend. Thank you.
My name is Jile Fitriata Taginting with the last three digits of my student ID is 140 and I will be concluding the student project. So to conclude, sleep is an essential physiological need, yet some are still deprived of it. And sleep disorders manifesting as insomnia, hypersomnolence, and others significantly impact the sleep quality, leading to lower quality of life. And mind body therapies is a practice which relates mental health with physical health, such as meditation and yoga, which helps to reduce stress and anxiety. Tai Chi reduces nighttime awakening and wake time. There is relaxation therapy, which enhances the cognitive performance, energy level, and daytime functioning. And there's music therapy, which relaxes the body, making it easier to fall asleep. Overall, they improve the sleep quality. These therapies have been proven to be effective. For instance, a study concluded that those who practice yoga more than twice a week have better sleep quality, and around 73.5% of elderly have better sleep quality while doing yoga. And that is all from our group. Thank you.
So, that was the presentation of our student project. We would like to apologize if there is any mistakes in our video. Thank you for watching.